Hi everyone, this is Susan again. This is another installment in my No Surprises Hip Replacement Recovery series. I talked to you last time about the fact that there can be surprises in many areas, and the latest surprise for me was regarding physical therapy. So, leading up to my hip replacement, I had actually been going to the gym and using an elliptical like an hour a day. I had been using a stationary bike regularly and walking, very active person. So I'm used to kind of being out there, being at the gym, that kind of thing. For me, what happened was my severe osteoarthritis, which was documented a few years ago, got worse. And apparently, I had a femoral head collapse, which meant that it had gotten to sort of the end stage. So even though I was functioning with some pain, it became necessary to get the hip replacement. So I thought, well, I'm going to get the surgery and then let's just then sign up for physical therapy. So I had my wonderful husband dragged him to the physical therapist. I think it was day 5 after the surgery, and went back and found a great physical therapist in advance. Awesome practice. And I don't think I was back in the physical therapy office for more than 15 minutes. And I came back out. And my husband said, "That's it?" And I said, "Well, that's it." And pretty much they'd asked me what exercises they told me in the hospital I should be doing. So I brought my sheets of paper, the basic things to be done. And that's pretty much what they did with me in day 1. And I thought, well, maybe this is day 1. So we went back the next day and the same thing happened. And then by the third day, I realized, I guess I need to probably regroup with my surgeon and find out, like, what can I really do at this point versus what do I need to delay? And that was a real surprise for me because I thought it was all about, get yourself moving, get yourself going. And, the sooner you take action and kind of do some stuff, you're going to get better. But in fact, the surprise for me is that apparently, based on the research that I've done, and I'll be talking to my surgeon for my 2-week visit in a few days, what you really need to do is really preserve and be comfortable in terms of how you're getting around. It's all about care in not twisting, not bending, doing the right moves so you're not hurting yourself. Yes, you want to be getting up and around regularly. And yes, you want to be following the basic exercises they told you in the hospital. But other than that, that's pretty much what you're doing. It's about preservation and being careful. So now I'll be finding out this week from my surgeon whether or not maybe it's week 4 I can start up on something more, or week 5. But that was a real surprise for me because I'd seen so many people on the internet who were up and walking and doing all this aggressive stuff. And again, everybody could be different. And as I always remind you, I'm not a medical professional, I'm not a physical therapist. So everybody's going to be different. But at least in my situation, it's a matter of doing some things gradually, going very slowly, so that eventually I'll progress really fast. So I wanted to share all of that with you because it might be something that you might be surprised about. I was. If I had known that, I would have not scheduled those appointments. I would have just remained at home, but I was told to go ahead and, make something scheduled, which I did because I was all committed to how do I move forward quickly. And yet the reality is your body needs some time to heal, to just kind of recover from really what's a trauma experience when you go through surgery. So I wanted to share that all with you. And I also wanted to share with you the number one thing, though, that you can get at home that will help with your physical therapy. So I talked to you about the one thing that you can invest in terms of helping with your physical recovery and in lieu of really going out to physical therapy sessions. And that is, you'll see I'm actually sitting on a reclining couch. Now, whether you have a reclining couch or crowning chair, either one of them, all the exercises that you're going to need to be doing in the first couple of days, you can do on a reclining chair or couch. As a matter of fact, having something like this has been so helpful for me for every surgery for different reasons. And with this one, it's great because obviously it enables you to get up easily by having that recliner motion. But also, as I can demonstrate to you, as you know, if you've gone through the surgery, some of the basic things that they ask you to do, this will actually let me glide pretty far back in sort of a whole flat position. so that when I need to do some basic ankle pumps, you can be doing them. When I need to be doing the pressing of my knee against them, I can put an ice pack or towel, which is another thing that they're going to be asking you to do. They're going to be asking you to be tightening your glutes, which you can do. So pretty much all the things that they're asking me to do, I could have this as a stationary thing and not worry about getting on the floor, doing anything different. I could also then, again, raise this back down, because there was another one of the exercises where they basically asked me to put a wash towel on the floor and gently glide my foot. Another one where they asked me to kind of raise my foot just ever so slightly up. So I'm not demonstrating these things specifically because, again, as you know, I'm not a medical professional. I'm not a physical therapist. I'm just trying to make the point to you that while people will tell you that there's a lot of different things you can get to help you with your recovery, I found that some things are worth it and some things, from my own experience, were not. I will say that this has been extremely helpful because it enabled me to get up easily, but more importantly, pretty much do all the physical therapy I needed from the comfort of my home in terms of what was allowed and appropriate and safe. And having kind of a safe space like this, knowing that this is kind of where you're operating from, really felt comforting to me to know that this is kind of the place I would go to kind of do that physical therapy. It was almost like having another place to go outside of my bedroom. I felt it was important to have another option. So something for you to consider in terms of your physical recovery. So as I mentioned to you, I was surprised when I went to physical therapy the first week that the sessions were really like 15 minutes long. And so after 2 weeks, I did my first check-in with my surgeon. And I asked him, can you give me any more perspective on my surgery in terms of how it went? Are there any specific restrictions that I'm having now in terms of doing more aggressive physical therapy? And he reassured me that no, the surgery went beautifully. You're just a typical case, no issues, just a regular kind of recovery process here. So it was very reassuring to know that everything really was coming along well. And so I then continued back to physical therapy the next week and had 3 sessions. And similar to the first week, they were pretty much repeating a lot of what I did in the hospital, but they very gradually started adding in a few new things in the physical therapy office. Now, at home, I was told to continue to still again do what I was doing from the hospital day one, but they were adding a few things gradually. And then the appointment times did get longer, so they were evaluating me. But one of the surprises I had was I was told that when I got the anterior hip replacement surgery, that probably after 2 weeks I could be driving. As long as I was off the heavy duty pain meds, I could drive. Well, the surprise for me is even though I was going to a professional physical therapist, they were evaluating my walking and my gait and movement. And they said, you're not close really at this point to be even going to a cane, let alone walking without a cane. We really advise, even when you're at home, you still need to be using the walker for a little while longer. And I appreciated their conservative approach. And as you all know, as I'm sure you know, the biggest thing after hip replacement surgery is that you do not want to fall. So the first 6 weeks are really critical that you're very careful, that you don't fall, because that could cause some serious damage. So it's something else that, again, I'll bring up to all of you that it could be a surprise, because today I'm talking to you and it's day 18 after surgery. I'm still using the walker. I'll be going to physical therapy again several times this week. They'll be evaluating me again. So even though technically I could drive, if you really can't safely get out of your car in a place where you can use a walker, get your walker out very safely, then you might be playing it at home a little bit longer than maybe you would expect. So it's just something to keep in mind. I did have to move back some appointments that I thought I'd be able to drive myself to after week 3 weeks, but that's not going to take place. But again, better to be safe. Glad I'm in the hands of some really good healthcare providers, so that's a good thing. But the other thing that I learned this week, which I wish I planned about in advance, was that you could get a temporary handicap sticker for your car. And so I brought that up to the attention of the doctor when I saw him this week. He was happy to fill out the simple form. Now, it could take a couple weeks before I hear back to get that official temporary tag. But obviously that's going to help a lot too, because even sometimes, right, if you're going to get somewhere, having those spaces that are closer, so you're minimizing your walking, particularly maybe if you're in an unfamiliar area going to a doctor's office, that could be really helpful. So it's just a mention to you that prior to your surgery, if you did not schedule the surgery yet, it's something you could apply for in advance and then have that more readily available. So again, just some more insights to share with you, some surprises, but some solutions to those surprises. And again, I want to remind you that I'm not a medical professional. I'm not a physical therapist. I'm just someone who went through hip replacement surgery, and always make sure that you listen to the advice of your doctor and medical healthcare team. And I also wanted to encourage you again that if you're finding this content to be very helpful for you, please do me a favor by liking and subscribing. That will ensure we'll develop some quality content and continue on the series with others. And so I hope this is helpful. In the months ahead, we'll be providing some additional content. But if you have some additional content that you would like to recommend or share based on any surprises you may have had, information that you had not seen elsewhere, please include those thoughts below so we can make sure that we share with the entire community helpful tips and information for them.